The use of portable ultrasound to estimate intravascular volume status and extravascular lung water has been validated in the management of acute respiratory failure and heart failure. The literature validates the use of ultrasound for evaluation and management of fluid resuscitation and hypovolemic states. We propose a sample protocol which integrates lung and IVC ultrasound to guide diuresis and renal replacement therapy in volume overload states in specific pulmonary edema. Use a phased array low-frequency probe. Select the appropriate machine setting. The abdominal setting will be used for this exam. In this setting, the screen marker should be operator left. The depth can be adjusted to provide optimal image resolution. For this exam, the machine depth is set to 8 to 12 centimeters. Place the patient in a supine or semi-recumbent position and expose the anterior chest. The probe should be held with the probe marker facing cephalad. With its probe marker facing cephalad, the transducer is placed at a 90-degree angle to the patient in the third and fourth intercostal space of the right anterior chest wall at the midclavicular and anterior axillary lines. This protocol is to be performed at 2 locations: the midclavicular line at the second to third or third to fourth intercostal space, and the midclavicular line at the fourth to fifth or fifth to sixth intercostal space. The same protocol and evaluation is repeated at the left anterior chest for a total of 4 locations of ultrasound imaging at the chest. An A-line predominant pattern is seen.